Inhalable formulation of ivermectin and theophylline to treat ARDS and ALI, acute respiratory distress syndrome and acute lung injury. So, just before I go ahead with the presentation, I'll tell you this particular formulation was developed during the COVID time with the funding of Indo-US, that is DST and Indo-US funding. So let me start with it. ARDS is common in about 67% of patients. Importance of this ARDS. So it is very common in about 67% of patients. The prevalence is with 42% mortality. And the factors that are responsible for this is pollution, aging, acute lung injury, wherein the patients are ventilated many times, and people with aspiration pneumonia, as well as trauma of ventilation, meaning the doctors, the physicians, that surgeons, that they do the surgical interventions. The trauma also leads to ARDS. Apart from this, the virus also causes ARDS. SARS-CoV-2, we saw the epidemic caused ARDS. H1N1 and H5N1, which were pandemics rather, during 2005, 2015. Then generally influenza, adenovirus, RSV, they keep affecting people. So this is also one of the reasons, viral infections causing ARDS. Apart from that, nosocomial, hospital acquired infections like HSV and CMV, and recent outbreak of dengue and Nipah. Nipah particularly closed Kerala completely. Now, what is the challenge? The challenge is basically it is extremely difficult to reach the site of injury, which is alveolus of the lung, and via any other conventional route of administration, be it intravenous, be it oral. So, what one would desire, the challenge is also that the particular substance or the formulation should be anti-infective, anti-inflammatory, and immunomodulatory as well, because generally when viral infections occur, the immunity of the person goes down. That also leads to lot of problems, and particularly ARDS. So you desire all three in one, in a formulation. So the available treatment currently is about corticosteroids, anti-infective drugs which are given orally. Corticosteroids are also given as inhalation, and some biologicals were tried during COVID time, which were otherwise used for arthritis. But individual drugs, all these individual drugs have their own problems, and therefore the prognosis is extremely poor. Aging population, increased BMI, basal body mass index because of lifestyle changes, and impairment of the immune system, even sepsis during hospitalization that leads to shock and death. So these are the reasons for poor prognosis. So what is the solution that we propose? We propose an optimized formulation of 2 off-patent drugs with targeted lung delivery via nebulizer or even a dry powder inhaler in very low concentrations of the drugs. Both the drugs used are in extremely low concentration. It shows excellent antiviral activity, the formulation that we prepared, with high selectivity index, in the sense that it doesn't affect the lung cells, but it kills the viral cells. Most important is there is no need of hospitalization. It can be used by all age group people, including children. It is stable at 2 to 8 degrees Celsius, meaning you have to keep it in the fridge. One can even, the outreach can be to tier 1, tier 2 or even tier 3 cities. We have come up to TRL 4 level, and we have a granted Indian patent. So novelty of this formulation is that it is inhalable combination formulation of 2 off-patent drugs, very, very safe drugs. and we saw 87% increased bioavailability of ivermectin than when it was given alone. We also saw 2 to 4,000 times of higher potency antiviral activity all on SARS-CoV-2 than only ivermectin. We could achieve adequate lung plasma ratio, that is 12:1 at 4 hours. We confirmed the safety of single dose on major organs, including the lungs, meaning heart, liver, brain, kidney plus lungs. It's a robust technology and extremely economic. Self-administration is possible by all age groups. So actually I am not able to see this from here, but let me just tell you, all that it shows is the first one is only ivermectin, and the second one is ivermectin plus theophylline formulation at a lower dose, and one can see that the increase in the bioavailability of ivermectin in the lungs is almost double, meaning 87% when we calculated, it's almost double. The dose given also was double, and the concentration obtained also was double by just adding a very little amount of theophylline at a safe dose. So we saw good antiviral activity. The IC50 was not 9 micromolars, and the reported only ivermectin activity is 2 micromole. So we really got wonderful activity by just addition of theophylline. That's because both the drugs are reported to have anti-inflammatory activity, immunomodulatory activity. Yeah, I'll just go through fast. Yeah. The market potential is, it is a wide range of risk factors that produce ARDS, accelerated pool of COVID-19 patients, and rising cases of air pollution, lifestyle disorders, increasing accident rates and trauma, all causing ARDS, growing geriatric population. All this gives a good market potential. Global ARDS, can I just come down so that I can at least read my slides? I'm so sorry. Yeah, please, can. I'm so sorry. Yes, so I was here. So this is the data that I got. Global ARDS or ALI population is about 150 millions per year. Annual population is 150 million people, and the growth rate is about 7.8 CAGR between 2022 and 2031. We can also see, we have seen it on COVID-19, but we could also see it on other viruses which cause ARDS. It is easily scalable. The marketing of this product will absolutely ensure a huge commercial and social benefits at an affordable cost to the company, at the same time to the end user. The channel for commercialization is, of course, through physicians and hospitals. The constraint is that the time for TRL9 is about 3 to 5 years, and funds, I estimated it about 3.2 crores of rupees. Equipment is high pressure homogenizer and ultrasonicator. However, customized APIs are also available these days, and the manpower would be needed for preclinical, clinical studies and regulatory support. I am looking out at easy and comprehensive tech transfer. For the company, the product launch will need GMP manufacturing in-house. I'm sorry, I'm not moving it there. I'm absolutely sorry. Yeah, the company would need GMP manufacturing, in-house stability and subacute toxicity, along with clinical studies. Expertise will be provided throughout the whole commercialization process. We will provide it. Thank you.